name is Audra. I'm a nursing student at St. Francis. Is it okay if I do an assessment on your newborn? Yes? Okay, thank you. I'm going to start by listening to your baby's heart and lungs and vowel sounds all at the same time. Okay, your baby's heart sounds good. There's no murmurs, and the bowels were active in all 4 quadrants. Normal vital signs for a newborn, the heart rate would be 110 to 160, and the respirations are 30 to 60. And I'm going to take the baby's temperature, and a normal range would be 77.7 or 97.7 to 99.5. I'm going to start my assessment at the head. I'm looking at the head and there is no bruising or scratches, and I'm feeling the fontanelles. They should be soft, and I'm making sure there is no cephal or SC, and a cephal is blood and SC is fluid, and that crosses the suture lines, and a cephal is blood, and that is when a vacuum is used during a vaginal birth. So moving down the head, I'm going to go to the baby's eyes, and the baby's eyes are symmetrical. So they're 1 1/3, 1 1/3. And moving down, I'm going to go to the baby's ears, and they are also where they're supposed to be, and they line up perfectly with the eyes, which is awesome. And I'm going to check for their recoil, and they respond fast, which means that this baby is term. And moving down, I'm going to check the baby's nose patency. So I'm going to check on the baby's left side first, and then I'll move to the right side. I'm going to put on some gloves, and I'm going to feel the baby's palate, and she is sucking on my fingers, which is good. I'm going to take off my gloves. Moving down, I'm going to go to the baby's neck, and I'm going to check her range of motion, which is good. And there is nothing on her neck, which is awesome. And moving down to the baby's clavicles. The clavicles are not injured or broken, and there are no masses on her clavicles. Moving down to the baby's belly, we listened earlier, and her bowels were active in all 4 quadrants. Her belly is round, and it is not tender. Moving to the baby's genitals, the baby is a girl, so the labia, and so she has a clitoris, and there is white discharge, which is normal. So I would just wipe that away, and I would clean her up. And then since she is a female, we'll do the male also. And so the meatus is on the tip of the penis, and then there's also rugae present, so there's wrinkles, and that is term. That means that the baby is term, and the baby is circumcised, and the testes are descended. So moving on, I will check and I will look at the baby's feet, and so I will count the digits. And so the baby has 10 fingers and 10 toes. And I will look at the baby's feet, and there are wrinkles, and so that means that the baby is term. And then you will also check the hands, and you will look at the lines and see if there are 2 or 1. And I will also go back up and check the baby's umbilical cord site. Her umbilical cord site is moist, and it is not red, and it is not draining, which is a good sign. Since we're done with her head to toe, I will flip her over. And we'll check her spine. There is no dimple or open spot on her spine, and if there was, that would be an indicator for spina bifida. Some signs of respiratory distress in an infant would be grunting, retraction, apnea greater than 20 seconds, seesaw breathing, and nasal flaring. Throughout this assessment, I have been checking the baby's skin, and it is appropriate for this baby. There are no stork bites, there are no Mongolian spots, there are no bruising, no scratches on her. And I would check her jaundice, so I would start at her forehead, then I would move to her chest, her abdomen, her thighs, and then I would go back to her eyes. There is no jaundice on this baby, which is awesome. And then I would also check the skin turgor. So you can check this in the abdomen and the thigh, and the skin turgor is good. One last thing I would do is check the baby's reflexes. So Moro, and the baby would respond, and then up and down, and the baby will go like this, and then Babinski, and then the baby will go like this. I would note any pees and poops. I would make sure that I would clean the baby up if they had an accident or if they just needed to be cleaned up. And then I would make sure that I would ask the mother the last time that they were fed. And that's all.